Time right now is 7:50 and the doctor is in. February is American Heart Month at a time when everyone should be taking a closer look at their heart health. So joining us live, we have Dr. Abby. So great to see you, Dr. Abby. Thank you for coming.
It's good to see you.
Let's talk about the importance of heart health. Obviously, we want to think about it year round, but extra important in February to bring attention to it.
Yes.
Why do we need to do this?
You know, because a lot of people unfortunately die from heart disease. So it's the most common cause of death in both men and women, and it's the most common cause of death by far. Hundreds of thousands of people die from heart disease. One person dies every 30 seconds from a heart attack.
Wow.
And then, of course, when you think about some of the consequences of heart disease like stroke, that's also a leading cause of death. So it's important. We all need to take it seriously.
So let's talk about things we can do, maybe even today. The best diet for our heart when we're thinking about what we're eating for breakfast, lunch, dinner. What do you suggest?
Yeah, so you want to think of this on sort of like a broad-based level.
Okay.
So essentially, all the things that most of us probably indulged in yesterday and had fun eating,
Right.
you want to do only on special occasions. You want to try to avoid those. So what we call trans and saturated fats, so things that have bacon, fatty meats, those types of things, cheese, you want to avoid those and limit them as much as possible.
Okay.
You want to eat more whole grains. You want to get protein from plant-based sources, so things like beans, those are very important, or lean meats. You want to try to cook with things like olive oil and plant-based vegetable oils. Those are things that you want to do. And then avoid excessive alcohol. That's important. Reduce the amount of sugar in your diet. And then limit processed foods. So you want to think about things like deli meats, where people think that those are really healthy, but they're not. You want to avoid those types of things. You know, you want to eat things that are closer to their natural state as much as possible, and more fiber. That's important.
A good way to think about it. The closest to the natural state. So an apple from a tree.
Yes, yes. Less salts too.
And less salts. Yeah. Okay. If we are concerned about our heart health, what symptoms do we need to look out for? What are the key things that you like to share?
Yeah, so the obvious things like chest pain, shortness of breath, but sometimes less obvious things like jaw pain, those are things that people may notice. But sometimes it's more gradual. So if you notice that you have less exercise tolerance, so you are able to run a certain distance and now you can't because you're short of breath, you're exhausted from doing that, then that's something that you want to pay attention to. Swelling of the extremities, those are things that you want to also be mindful of. But it's important not to freak out immediately if you have these symptoms, right? Because they may not be from heart disease. So definitely talk to your doctor if you notice that.
So even if you're maybe unable to do as much in your workout, should you call your doctor, make an appointment just to check in case?
Yeah, yes. It's always a good idea to check in with your doctor. It may be because you haven't exercised as much. If you're starting a new regimen, of course, you're not going to be at the same level. So there's no need to freak out there. It's really when you're seeing this very acute change that is a sudden change, then you definitely want to seek attention.
Because when we think it's the leading cause, there are things that we're doing wrong that are leading to this. And I know a lot of times we talk about it, but it's because we're not taking care of ourselves and getting checked when we need to.
Yes, that's true. You know, because we're all busy, right? Life is harder for a lot of people now. We don't have a lot of time, as much time as we did in the past. Everyone has responsibilities, but it's important to realize that there are risks that you can mitigate by exercising, knowing all your numbers, watching your BMI, limiting your chances of having things like diabetes. All of these things are important to prevent heart disease.
Always great to get your insight, Dr. Abby. Thank you for joining us.
It's good to see you, Netta.
Good to see you too. We'll be right back after this quick break.